natin sa telebisyon at live streaming. At magandang umaga rin po. Good morning sa mga FOCAP members natin ngayon. Ladies and gentlemen of the Malacañang Press Corps, last week, the Philippines reported its first local transmission, prompting our health officials to raise the Coronavirus Disease 2019 or COVID 2019 to Code Red Sublevel 1, which will be discussed by one of our resource persons, Health Secretary Francisco Duque III. Our health officials and I have said earlier that it is just a matter of time before the Philippines would have its first local transmission. The government, however, assures our people that concerned agencies are taking the necessary actions to quell the spread of COVID-19. Let us focus our energy and conviction to address the public health emergency. We likewise reiterate our call to stop spreading rumors and goading fears, as well as ending the stigma against specific nationalities or race. On the part of the Presidential Communications Operations Office, we will continue to be the lead communications arm of the government, which has been at the forefront in delivering timely, accurate, and reliable information about the COVID 2019. Even before the first reported case of local transmission, the different offices under or attached to PCOO, in coordination with key departments and agencies under the Interagency Task Force on Emerging Infectious Diseases, have been working around the clock in providing regular updates disseminated across all media, such as TV, radio, print, digital, and on ground, with Laging Handa as our dedicated platform for COVID 2019. Further, upon the instruction of President Rodrigo Roa Duterte, regular updates, news, and public service announcements in relation to the coronavirus have been aired on government broadcast stations, print, and online platforms. From the weeks of January to February 29, 2020, the PCOO has made approximately 70 informational videos, more than 5 radio plugs, more than 1,250 social cards, and approximately 20 infographics on the COVID 2019. We have likewise provided more than 750 online news articles, more than 400 broadcast news items, both for TV and radio, close to 30 news articles which saw print, more than 500 situational reports, more than 450 text blasts, more than 280 news tweets, more than 70 radio live interviews, approximately 350 flyers in English and 300 flyers in Filipino about the coronavirus. Our on-the-ground events included 5 Laging Handa press briefings here with the Malacañang Press Corps, more than 25 regional and provincial press briefings, close to 15 TV and radio guestings and kapihans, 44 regional interagency meetings, and 1 strategic communication workshop which we spearheaded for key departments and agencies. We also convened the RTF with ARPOC Region 10 exclusively for COVID-19 after the President met us a month ago. In addition, PCOO conducted 34 live stream media coverages and 2 exclusive coverages, including the repatriation of Filipinos from Wuhan and MV Diamond Princess. These, among others, we have done, not including our action items for the month of March. We do not work in a vacuum. Challenges continue to mount. While we have exerted a lot of man-hours and resources in information production and dissemination, much more needs to be done in reaching out to the rest of our people, especially now that we are in Code Red. Rest assured that we will give a strong and united message in coordination with IATF members and ensure to double, if not multiple, our interventions for the needed information of the public. Vigilance, preparation, and solidarity are what we need, both in the private and public sectors. All hands on deck, and we will not lower our defenses. As a matter of fact, the kapisaran ng mga broadcaster ng Pilipinas, officers are waiting upstairs for meeting to boost our messaging platform for COVID-19. With regard to the comment of Senator Nancy Binay, that is the vibrancy of our democracy, the checks and the balance. But we assure the good senator that the PCOO is coordinating with the IATF members since day one, and we will forward a departmental report to the office of the good senator this afternoon. Thank you, and we shall now start with the statements from... Okay. Okay, we will play a video.
Umiwas sa mataas lugar. Iwasang hawakan ang ilang maging malinis sa katawan at ugaliin ang wastong paghuhugas ng kamay. Takpan ang ilong at bibig kung uubo o babahing. Umiwas sa mga taong nagpapakita ng sintomas. Pangalagaan ang sarili laban sa 2019 novel coronavirus. Hanggat maaari, umiwas sa mataong lugar. Iwasang hawakan ang ilong at bibig. Maging malinis sa katawan at ugaliin ang wastong paghuhugas ng kamay. Takpan ang ilong at bibig kung uubo o babahing. Umiwas sa mga taong nagpapakita ng sintomas ng nCoV. Alertong pangkalusugan. Mag-ingat sa coronavirus. Ang coronavirus ay pamilya ng mga virus na nagdudulot ng iba't ibang sakit, mula sa karaniwang ubo at sipon hanggang sa mas malalaking impeksyon. Sa mga malulubhang kaso, maaari itong maging sanhi ng pulmonya, acute respiratory syndrome, problema sa bato, at pagkamatay.
Buong mundo ang lumalaban. Coronavirus Disease 2019.
Our government has already been coordinating with the government of Japan, as well as we sat down with the MV Diamond Princess handler here already to negotiate our terms para makuha na ho natin kung paano natin gagawin itong pagre-repatriate.
Kapakanan ng publiko, hindi pinababayaan, pamahalaan, kabi-kabila ang pagbabalita sa bayan. Sundan ang laban ng Pilipinas at buong mundo para COVID-19 ay tuluyang masugpo. Dito sa estasyong para sa bayan, Radyo Pilipinas.
Those are just some of the samples of our PSAs. We shall also be sending copies of government PSAs or public service announcements, Radyo Pilipinas, PTV, Philippine News Agency, the Philippine Information Agency. We shall be sending these copies to the office of the good Senator Nancy Binay. Now I turn over to Yusek Roque Ignacio to introduce our guests today.
Yes, can we have Secretary Francisco Duque III, Dr. Rabi, Yusek Benito Bengson Jr., and ASEC Eduardo Martin Meñez. Secretary Duque.
Opening statement, sir.
Yeah, okay, thank you very much. Good morning. Magandang umaga po sa ating lahat. Today, I will give an update as to the COVID-19 global situation and more importantly, the local situationer for COVID-2019. As of March 8, 2020, there are a total of 105,586 cases of COVID-19, and this has spread to 101 countries, 53 of which have transmission unrelated to China. Over the weekend, we had 4 more confirmed cases, bringing the total number to 10, and I will expound on this a bit later in the question and answer portion of this press con. Upon confirmation of so I have said there are 10 confirmed cases, 41 patients under investigations, PUIs, currently admitted. Upon confirmation of local transmission, we are already in door 4 of our response framework. Because we have anticipated the need to, and thus have coordinated closely with the NDRRMC, or the National Disaster Risk Reduction Management Council, we had to align the code alert system we used to implement in all emergencies. This was agreed upon during the 6th Interagency Task Force. As such, Door 4 corresponds to Code Red. The main triggers for entering Door 4 is at least one documented case of localized transmission, and will continue while there is a sustained human-to-human or community transmission. Moving from one local or localized transmission to sustained community transmission can happen very quickly, so both fall under the Code Red. I wish to make clarification on a few items. First, contact tracing is done proactively. It is our surveillance teams that will reach out to close contacts, defined as follows. Number 1, those providing direct care without proper personal protective equipment. Second, staying in the same close environment within the past 14 days. Third, traveling together in close proximity within 1 meter or less with a COVID-19 patient within a 14-day period. Let me clarify that all others who have visited places frequented by confirmed cases of COVID-19 are not required to seek medical consultation and subject themselves to COVID-19 laboratory testing. They are advised to self-monitor, and if with symptoms, consult health center or rural health units for appropriate management and monitoring. Second, reminders for our level 2 and 3 hospitals. I wish to emphasize a few things for our healthcare providers. First, all levels 2 and 3 hospitals are reminded to not refuse patients suspected or diagnosed with COVID-19. Refusal to provide care to said patients shall be considered a violation of the signed performance commitment and shall be dealt with by PhilHealth accordingly. Further, we are recommending levels 2 and 3 hospitals to designate a triage area in their emergency rooms or OPD for screening suspected COVID-19 patients. Finally, all levels 2 and 3 hospitals are directed to attend to all patients suspected to have the COVID-19 and those confirmed COVID-19 with mild symptoms. Only confirmed COVID-19 patients that are severe and critical shall be referred to the Research Institute for Tropical Medicine, or RITM, the San Lazaro Hospital, and Lung Center of the Philippines. We must always note, as much as 80% of confirmed cases of COVID-19 are mild. And for the large part, the data that we're using here are those coming from China, and as confirmed by the WHO. Also, from here on, the DOH will be disclosing hospital names after coordination with hospitals to combat unverified or fake news. We would like to take this opportunity to reassure the public that our hospitals have infection prevention and control practices in place, so there is no need to avoid going to these hospitals, especially if you feel unwell. For example, hospitals are already performing quarantine of their health workers, among others. Finally, to answer questions on suspension of work or school, we respect LGU's decision to proactively suspend classes. Our expert advisory group will meet this morning with DOH, the DOLE, or Department of Labor and Employment, as well as the CSC, or Civil Service Commission, and DepEd, and issue recommendation that will be ratified in the Interagency Task Force at 5 p.m. this afternoon. So this will be all for now, and thank you very much.
Can we have Dr. Rabi? Okay.
Thank you very much.
Kasalukuyan natin kinaharap ang COVID-19. Ngunit tulad ng SARS, 17 taon nang nakalilipas, atin ring itong lalabanan.
Bawat isa ay malaki ang maitutulong sa pamamagitan ng regular na paghuhugas ng kamay, tamang paraan ng pag-ubo, pagpapanatili ng 1 metrong distansya sa mga may sintomas, at pagsusuot ng face mask kung ikaw ay may sakit.
Todo laban kontra COVID-19.
Can we have Dr. Rabi?
Thank you again and good morning. May I have the presentation, please? So I wish to give you an update on the global situation, and Secretary Duque has made my life a little easier. But just to highlight, can I have the next slide, please? Just to highlight, we have passed a very somber moment over the weekend. Not only did we pass the 100,000 cases that have been confirmed globally, but we also acknowledge now that more than 100 countries have confirmed COVID cases. These are significant milestones in the battle against coronavirus disease, and WHO reiterates that we can still control the spread of this disease and prevent it from becoming a global pandemic. Next slide, please. This slide shows to you the increasing trend of cases that we have seen globally since the 21st of January to date. And you will see that we are now seeing in the last week or so rapidly increasing curve towards the end of that, towards the right side of that graph. We are seeing not only increasing numbers of cases globally, but we are also seeing a steady increase in the number of deaths. Next slide. More closely, the next slide, please. On the next slide, we see the increase. Sorry, go back one, please. On this side, we are seeing the number of cases now being reported outside of China. And the numbers are predominantly now more than 90% of cases coming in the recent few days are outside of China, and so are the numbers of deaths being reported, highlighting again the fact that while the efforts in China have been successful in controlling the spread, we are seeing localized outbreaks affecting many other countries, especially the Republic of Korea, closer to the Philippines, but also Italy and the Republic of Iran. Next slide. Based on the data from China, we still, and also from other data we are now seeing increasingly from other countries, we are seeing that about 81% of the cases are mild, 14% have severe symptoms, and about 5% are critical. Next slide. About the vast majority of the people who develop critical and severe disease or transition from severe to critical are elderly subjects who have coexisting medical conditions. This is important for us as we acknowledge that in the Philippines we are now having local transmission. I will speak to that a little later. Next slide. So I want to reiterate again the fact that this disease is largely transmitted through droplets. We are still have no evidence that this is transmitted by air. It is a disease largely limited to droplet and close contact. And this is why WHO continues to advocate for the practicing of hand hygiene, cough etiquette, and social distancing. Next slide, please. As countries transition from having just reporting cases among travelers to having situations where you're seeing localized transmission, the messaging needs to be very clear about the risk posed by this infection, the fact that a large majority are mild symptoms. And so while coming in the Philippines for determining localized transmission and proactively deciding to implement the fourth DOE or Code Red, it also confirms the need for us to have a whole of government, whole of society approach. And given the nature of the disease, that this disease is largely a mild disease, we want to reiterate again the importance for people who are having respiratory signs and symptoms to practice social distancing. Do not go to work, do not go to school, do not go to crowded places if you're having signs of respiratory infections. This may largely not be COVID-19, but it is rational to follow the advice in view of the fact that we are having localized transmission to practice social distancing and prevent even other respiratory infections being transmitted. If you have had contact with confirmed cases, and Secretary Duque, again, thank you for clearly explaining who we mean close contacts, and you develop symptoms, you need to isolate yourself and you need to inform your local health authorities so that appropriate assessments and control measures can be implemented. Next slide, please. I'm not going to go into a lot of the details, but I just like to highlight that with localized transmission, the thrust of our activities will cover 5 areas. That's public health measures, improving clinical management, including infection prevention and control as described by Secretary Duque. We recognize the vulnerability of the elderly population in this scenario, and we encourage especially those groups to refrain from going to crowded places as much as possible, and to ensure that they protect themselves. For this we need a community-wide response. Family members need to support the elderly to protect them and minimize the risk of infection. The DOH has been doing an excellent job in strengthening its surveillance capacities and its risk assessments. We've seen the DOH teams with the relevant regional teams working almost 24/7, tracing contacts, identifying people at risk, and implementing recommendations to contain the spread of this localized transmission that we've seen over the last few days. It is important to recognize that appropriate risk communication is conducted, and we acknowledge here the support of the DOH and the Presidential Communication Unit in taking this message. And we are working together with the DOH also to strengthen its capacity to diagnose suspect cases who actually will need laboratory confirmation. I will not talk at length to all of the other technical slides that I have. I will stop here. Thank you very much.
Can we have Yusek Bengson, please?
Thank you. Can you hear me? Good morning. Magandang umaga po. In light of the outbreak of COVID-19, the Department of Tourism is bracing itself to face yet another challenge. But prior to the recent declaration of a state of public health emergency, the DOT last week convened a special meeting of the Tourism Coordinating Council, or the TCC. The TCC is an institutional arrangement, a 25-agency body created under Tourism Act of 2009, and that particular meeting last week aimed to provide a platform for the members of the Council and selected government agencies to share their initiatives on alleviating the impact of COVID-19 health crisis on tourism enterprises and workforce. So for this morning, I'd like to do a brief presentation on the interventions, the measures that the DOT has taken to mitigate the impact of COVID-19, as well as the recommendations coming from the members of the TCC. The DOT will therefore be focusing more on domestic tourism as we see a slowdown in the movement of our traditional source markets. The upside to it is that as we push for domestic tourism, we have secured the assistance or the support of our carriers such as Philippine Airlines, Cebu Pacific, AirAsia, who have started rolling out discounted flights around the country. And all these promos culminated last week, where the 3 companies gave their biggest sale in recent history. To further propel domestic tourism, DOT-accredited hotels and resorts will be lowering their prices anywhere from 30% to 70% off the published and online rates in order to be more competitive with our neighboring Southeast Asian countries. Our accredited tour operators will also be giving up to 70% discounts on domestic tour packages. To strengthen public-private partnership initiative, the DOT will be allocating approximately 6 billion pesos that will span international and domestic promotions, infrastructure, and regional tourism development. From this budget, we will allocate approximately 85 million pesos for trainings for COVID-19 orientation, preparedness, response, and protocols for industry stakeholders, Our Manpower Development Office will tweak our Filipino brand of service to include points on how to handle guests for COVID-19 and response. This will include integration of DOH guidelines in all trainings to be conducted moving forward. The DOT has also cascaded the proper guidelines for our accommodation establishments on how to deal with guests in light of COVID-19. These protocols include the use of infrared thermometers to check one's temperature, screening guidelines, and provision of hand sanitizers. We will also be providing regular updates through a recently created website. It's called www.philippines.travel/safeph, which will serve as a splash page both to our corporate and marketing websites. On the part of the Tourism Coordinating Council, the TCC members and the partner agencies shared their ongoing initiatives and proposed interventions to help the tourism industry during this crisis. On the part of the DENR, it has committed to build destination resiliency by strengthening environmental protection programs in destinations and through the construction of STPs, particularly in Coron and Puerto Galera. On health and safety protocols, as mentioned, the DOT will work hand in hand with the DOH, the DILG, to craft a joint memorandum circular to establish protocols in reporting, security, and health measures in light of the crisis. On airline protocols, the Department of Foreign Affairs has been informing foreign service posts about the Philippines' health protocols and other important information to assure tourists, governments, and partners abroad. The Department of Transportation, together with airport authorities, particularly CAAP and CAB, is implementing safety protocols in the airports, disinfection of airport lobbies and boarding bridges, and sanitation of the aircraft before landing in Philippine airports is also being strictly enforced. On employment, the tourism sector is responsible for 5.4 million jobs, or approximately 13% of the country's employment. COVID-19 poses a threat to some of these jobs, and the Department of Labor and Employment has provisions for emergency employment and livelihood assistance within its limited scope. On flights, given the reduction in international flights, the vacant airport slots are being offered by the DOTR to local carriers to increase domestic flights. There is also ongoing discussion with airlines for the proposal to reduce or waive landing and takeoff fees based on the letter of the Air Carriers Association of the Philippines to the agency. The Philippine Amusement Gaming Corporation, PAGCOR, also pledged during the TCC meeting to support and finance procurement of supplies that are necessary to the implementation of health protocols such as face masks and thermometers. We will also be meeting with the Department of Trade and Industry to address the supply constraints being encountered by the LGUs related to the procurement of masks and other necessary supplies. We will be conducting a study for possible adoption of measures implemented by other countries to provide relief to tourism businesses and workforce. These are the existing and proposed measures that the DOT, along with our partner agencies and private stakeholders, are taking. Rest assured that the Department is exhausting all means to overcome the hurdles that this global crisis has thrown on us. We will leave no stone unturned to help the Filipinos rise against the challenge of COVID-19. Thank you.
Thank you. Sec Menyes.
Thank you. Good morning, Sec Andanar, Sec Duque, Yusek Bengzon. Good morning, Dr. Rabi, and the Malacañang Press Corps, and the members of the Foreign Correspondents Association. Before I begin the PowerPoint presentation, I just want to reassure everyone that the Department of Foreign Affairs is closely monitoring the situation around the world, and we commit to report the accurate information regarding the situation of our Filipinos overseas, and we will act to protect and, when necessary, repatriate the said Filipinos. So, beginning with the events from last Monday, as all of you are aware, on the 7th of March, we had the repatriation of the 163 Filipinos who were stranded in Macau. And this was done through a special chartered flight. And all health protocols were observed, both in Macau and upon their arrival here in Manila. And as far as we are informed, none of them exhibited any symptoms, and therefore all of them are now undergoing home quarantine. We also, the next slide please, in the period since last Monday, the DFA has issued a number of advisories informing the Filipino public of the various travel restrictions imposed by other countries on travelers from the Philippines. On the 4th of March, the DFA issued an advisory on the temporary travel ban imposed by the Kingdom of Saudi Arabia on the Umrah visa holders and on tourist visa holders. It was also clarified that Filipinos who hold visas for employment, work visit, business visit, and family visit are still allowed entry into the Kingdom of Saudi Arabia, and we also provided the contact numbers of our posts in Saudi Arabia in case there are instances of problems arising from the travel restrictions. We also issued an advisory on the restrictions by the Kuwaiti government for imposing restrictions from travel from the Philippines for a period of 1 week. The said travel ban, as a result of that, we did receive reports and confirmed that a number of Filipinos who were en route to Kuwait were subsequently stranded in transit airports like in the United Arab Emirates and in Qatar. And our posts in those countries have also acted upon those particular issues, and a number of those Filipinos who were caught in those airports have already been repatriated. We have also released the information on these advisories as to how to contact the embassies in those countries. We also received information and released an advisory on travel to certain areas in Israel, because both the Palestinian Authority and the government of Israel restricted travel, the entry of all tourists into the West Bank, including Bethlehem and Jericho. And so, again, the information on what to do in case there are Filipinos affected by said restrictions are in the advisory. With countries around the world striving to address this current global health crisis through various precautionary measures, including travel restrictions and bans, the DFA advises the Filipino public here and abroad to remain vigilant and to be accurately informed by sourcing information from the official and legitimate authorities and verified sources. The next slide. On those countries that have categorically imposed travel bans, we also have information, as I mentioned, on the Kingdom of Saudi Arabia, on Kuwait, whose latest guidelines started from the 6th of March. We also have information that the Cook Islands has also restricted travel from certain COVID-affected countries. And just late yesterday or early this morning, the government of Qatar has also imposed temporary travel restrictions on Doha-bound passengers who traveled from 14 identified countries, including the Philippines. And this covers all travelers who have been in those countries within the last 14 days. Again, all our Foreign Service posts are constantly reporting to the Home Office and also informing the public through their own web pages and social media platforms about the constantly changing requirements with regard to the COVID situation. The Grand Princess cruise ship. Again, as many of you who have been monitoring the news around the world, this is the latest cruise ship that has been held off the coast of California, San Francisco in particular, and we have already confirmed that there are Filipinos on board, and the latest information that we have is that there are 529 crew members and 9 Filipino passengers on board said ship. The U.S. government has announced that the ship will be allowed to dock in Oakland to allow the passengers to disembark. And from latest reports, it appears that the crew, after disembarkation of the passengers, the ship will again put out to sea, and the crew, as of latest report, will remain on board and will undergo a quarantine process, probably allowing them to place themselves in separate rooms and receive the appropriate treatment on board. The DFA, through our Philippine Consulate General in San Francisco, is closely monitoring the developments on this particular cruise, and as of this very moment, discussions are already being held as to how to address the situation and conditions regarding the Filipinos on board the ship. On the status of other Filipinos COVID positive abroad, as was mentioned by Secretary Duque and Dr. Rabi, the situation has now progressed to that now you have more new cases being reported in countries around the world outside of China. And given the situation of the Filipinos, both in the Philippines and abroad, we are of course now facing this problem on multiple fronts. So we are very focused here in the Philippines, under the guidance of the Department of Health and the entire government, on the Filipinos in the country. And in the same manner, we are expanding our efforts to cover the Filipinos who are found all over the world. So on this slide, you will see the latest information regarding the situation of the Filipinos in Hong Kong. As was reported, there are already 4 Filipinos who have been declared COVID positive. In Singapore, the figure remains at 3. In the UAE, the figure also remains at 2. In Japan, the 80 crew members who were left in Japanese health institutions, out of the 80, 40 have recovered, and 21 out of the 40 have already, in fact, returned to the Philippines. And the other 19 are progressing well as far as their health is concerned, and hopefully they will also soon be repatriated to the Philippines. We also received information that two Filipinos have also been identified in Lebanon. We also have information, and some of this I already mentioned previously, of several countries who have imposed travel restrictions on tourists, and this covers not only the Filipinos. As mentioned a while ago, the Palestinian Authority and the Israeli government have decided to restrict travels to the West Bank and Bethlehem and Israel. So we already advised all Filipinos considering travel on pilgrimage in particular to check with their travel agencies and act accordingly. We have already assisted a number of Filipinos who were caught in that area when the travel restrictions were announced. In Nepal, starting on the 7th of March, the visa on arrival facility for all tourists has been suspended, and all of you have access to several online apps that will show you the number of COVID positive persons within particular countries. For Nepal, this is so far 4. In Fiji, where there are currently no confirmed or suspected cases of COVID, all cruise ships entering Fijian waters will require to berth at certain ports, and all passengers on board are required to undergo medical and travel history checks. And in the Seychelles, all foreign workers who are presently abroad in countries which are COVID affected and were planning to return to the Seychelles are directed to postpone their return travel until further notice. We also have unconfirmed reports as of the moment that there have been COVID cases identified in the Maldives, and some resorts have been locked down. So we will be updating our information as developments arise. Thank you.
Okay, question. Jinky. Microphone, please.
Good morning po. Sa DOH, sir, kay Secretary. Hi, sir.
Hi, good afternoon.
Sir, the President has just signed the EO declaring the public health emergency, sir. Can you please expound po the state of public health emergency? Bakit po kinakailangan magdeklara tayo nun?
Well, the declaration proceeds from the law, which is the RA 1132, which is the Disease Notifiable Act. This is reporting of diseases of local and international public health concern. And the trigger for the DOH to endorse to the President to declare a state of public health emergency is the one localized transmission as reported last Saturday. Okay, so the objectives are clear. There are about 6 for which this declaration is being made. Number 1 is to facilitate access of sufficient funding, especially for the local government units who need such funding for preparatory activities, if not for actual response. Number 2 is for purposes of easing the procurement process, not necessarily mean to avoid procurement altogether, but just to streamline the procurement process so as not to consume an inordinate amount of time to get the materials on board to support us in our COVID-19 response. And then number 3 is the mandatory reporting. It is crucial that under this declaration, all health facilities, including private hospitals, and obviously the public hospitals, the local government unit hospitals as well, must continue to report to the DOH for their intensified surveillance of influenza-like illness and also of the severe acute respiratory illness. This will guide the DOH to have a more focused isolation, detection, and then contact tracing. And so this is certainly crucial. And then the 4th objective is really to do mandatory quarantine. Once justified, once the situation calls for this, the DOH order for quarantine must be followed in earnest by everyone, together with the local government units and the enforcement agencies. And then, of course, 4th would be the implementation of travel restrictions, which we have done since the 2nd week of February. And last but not least, of course, is to empower and authorize the Department of Health as well as the Department of Trade and Industry to do price freeze on very crucial materials, PPEs as an example, so that this will not be taken advantage of by unscrupulous businessmen, or so there's been a tendency to increase prices. Given the difficulty of the situation, this is not acceptable to us. So this is one of the reasons for which the declaration has been made.
Sir, speaking ng localized transmission po, kumusta na po yung present condition ng 62-year-old male po? Na
guarded.
As of this time?
Yes, it's still guarded. This is a critical case. The elderly individual male has pre-existing medical conditions, hypertension, diabetes, and also enlargement of the prostate, and also the kidneys are also affected. And so we're doing everything to save the life of this patient. But you must be aware that for critical cases, the time it takes for them to recover is rather extended from anywhere 3 to 6 weeks. So he will stay in the hospital, and hopefully in the coming days we will see more improvements.
Sir, one last na lang po. Si Congressman Salceda, parang pinopropose po niya bakit hindi na lamang daw i-lockdown ang Manila if in case may kukonsidera po ba ito? And if makonsidera, anong magiging scenario natin?
Well, the protocol, in fact, includes that, but it might be premature to do it at this point. So we will have to wait until evidence of sustained community transmission is presented, and that will trigger the community lockdown or community quarantine. It's one of the interventions as reflected in our protocol, in our 4-door response strategy. There is also the option to suspend classes or work. There's also the option to make sure, let me just, to ensure that there is augmentation or preparedness on the part of unaffected regions, LGUs, and also uniformed personnel of the military and the PNP to assist and to complement the efforts of our local chief executives and local health officials in the affected communities. This is one. These are some of the options being considered, but it might be premature at this point. However, let me just reiterate my earlier statement that we need to respect the local chief executive's decision to suspend classes, and that must be followed by all concerned. So kung pwede lang po na ganon ang atin, kalimutan ko mas marami palang Pinoy dito kaysa sa FOCAP. Sabi sa akin, kailangan daw Tagalog. Baka naman hindi maintindihan. I'm sorry.
Thank you, Secretary.
Okay, Trisha, then Sandra, Heidi, then Pia.
Hi, Secretary. Good morning. Sir, since the localized transmission, there's already fear or some sort of paranoia among the people. How do we know now, sir, if, for example, we're experiencing symptoms, any of the symptoms, how do we know if it's time to consult a hospital or to go to emergency rooms to be tested for COVID-19?
Well, you have to ask yourself the following questions. Have you been exposed? Have you had travel history to countries with spread of COVID-19? And have you had history of exposure to a person who has been diagnosed with COVID-19? So the contact tracing teams have been deployed. We have, I think, about 10, but I will have to validate because that is the number of contact tracing teams has in fact increased since yesterday upon receipt of the information that 4 more patients have been confirmed as positive for COVID-19. So the contact tracing of close contacts is really crucial, and that is what our epidemiologists and surveillance unit officers are doing as we are talking. So we will get the full result of the investigation by these various teams. So again, going back to your question, ang dapat ay tanungin ang kanilang mga sarili. Kung sila halimbawa sumakay sa isang eroplano na alam natin yung flight number, yung details noon, then they should now consult with the local health officials where they come from, and then explain how close were they in contact with, say, the confirmed patient who took the plane, because some of these took the plane, and so that is already in the protocol, and it just needs to be followed.
Pero sir, paano po kung walang travel history or parang wala namang unknowingly nag-interact sila with a positive case?
Well, unknowingly, still the mode of transmission is via respiratory droplets. Okay, this is not something that gets admixed with the air current that is going to travel far. So this is still a very limited distance within which the respiratory droplets may land on the surfaces, and once this next person might, contaminate his hand, that could readily transmit the virus. So, kung mga casual lang na nagdaanan, hindi naman kayo dapat mag-alala. Kasi hindi naman yan as if sumingha, nag-high five sa inyo, kinamayan kayo. Kung wala ka naman ganun na alala, you don't have to be alarmed. So, okay lang.
Sir, speaking of contact tracing, kumusta po yung contact tracing dun sa case natin, yung sa prayer room na na-discover, sir?
Yeah, pinagpapatuloy po ito at mabibigyan natin kayo ng sapat na updates, hopefully this afternoon. But that has been done, but we're trying to get the leaders of that group to be more cooperative.
Percentage, sir, as to how gaano karami na yung number?
I'm not sure whether it was 67%, but I have to validate of those planned for contact tracing.
Okay. Thank you, Sandra.
Secretary, Meron na po ba daw IRR yung Republic Act 11332?
I think meron na. If I'm not mistaken, this must have been already promulgated 2 weeks ago. But let me just double check.
2 weeks ago. Kasi na-mention din po ni Secretary Drilon na parang wala pa raw ho yung IRR. But just the same, sir, do you think with the EO, ma-address na po yung concern as to siguro yung declaration ng mga public and private hospitals na meron silang hawak ng mga cases?
Oh yes, that is part of the mandatory reporting requirement under the declaration.
And sir, I understand yung RA refers to yung reporting no ng mga ospital, but how are we going to compel a private individual talaga to declare to report on the travel history and his health condition?
That is immediately executory. I mean, that declaration compels even individuals, but in a way that they did not have to identify themselves. So the contact tracing team knows exactly how to approach this without having to expose the identity of the individual.
So parang depende na rin po sa tao kung aaminin niya ito. Pero paano niyo po sila hinihimok siguro? No?
May proseso po yan.
Transparent.
Yes, may proseso po yan. Halimbawa, pagka naging positibo sa RITM bilang tagapagsuri ng kanilang specimen, meron tayong automatic na record. So, hindi naman po problema yon.
Okay, thank you, Sandra. Heidi, Pia, and then from CCTV.
Good afternoon po, Secretary Duque. Meron na po ba tayong summary of places lang po kung saan matatagpuan yung 10 confirmed cases? Kasi nagkakaroon po ng confusion dahil yung iba pong mga LGUs nag-a-announce po na merong case po sa lugar nila. Parang akala po ng ibang tao, plus pa po yun dun sa 10 na confirmed cases po natin.
Ayusin natin to mamaya sa aming press con ng mga alauna para mas masabi natin kung ano-ano yung mga lugar. Hindi ko lang po kasi dala, pasensya na po.
Okay, Pia.
Sir, ulitin ko lang po yung question kasi nag-announce po yung Marikina LGU and Quezon City LGU. Ito po, at least itong dalawang case na ito, sir, kasama po ba siya doon sa 10?
Yes, I think so. Oo. Yan na yun, dalawang kasama.
So, hindi po siya additional doon sa...
Hindi po. Mamaya po, lilinawin natin.
Okay po. Kay Yusek Bengzon, sir, tuloy pa po ba yung plano ng Department of Tourism na yung sa mga trips ni President Duterte to encourage domestic travel in the Philippines kahit may local transmission na?
Well, sa ngayon po, tuloy-tuloy pa rin ang aming kampanya for domestic tourism. Of course, syempre, papakinggan natin yung mga bulletins, advisories na nanggagaling sa Department of Health. No? Talagang sinusunod naman natin yan. But siguro ang kailangan din natin maintindihan dito, nagkaroon tayo ng slowdown doon sa mga pagpasok ng mga foreign tourists, doon sa mga usual source markets natin. And what we need to do is to keep tourism activities going, no? Especially at the local communities. So, by shifting to domestic tourism, matutulungan ho natin yung mga hotels and resorts, no, na tuloy-tuloy yung operations nila, matutulungan natin yung mga kasama dun sa industriya, no, na naghahanap buhay, yung mga bankero, yung mga nagbebenta ng souvenirs, no, yung mga nag-ooperate ng mga restaurants. And ito po yung thrust namin sa Department of Tourism ngayon. Ang instruction sa amin ni Secretary Puyat is to push for domestic tourism so that the establishments are able to operate at a viable level. At tuloy-tuloy lang po yung mga activities natin.
So I asked the question, Yusek, kasi ang PSG naglabas po ng statement that yung mga events ni President Duterte will be assessed or could be canceled then depende sa situation. So far, sir, yung na-announce kasi yung Boracay trip. So tuloy pa po ba, sir? May announcement?
Pag-uusapan niya yata mamaya yan. The details are being finalized. No? But yung as far as our domestic tourism campaign is concerned, tuloy-tuloy po ito.
So hindi lang din po sure kung si President Duterte kasama. Thank you, sir.
Okay, from CCTV, Rosalie Then Tuesday and Jen.
Thank you. I have a question to Secretary Duque. So now China is sharing its experience fighting against the epidemic, and is DOH going to follow up some of the experience and work with the Chinese medical organizations? That's my first question. And the second is, China now is producing a kind of a testing kit with results available in 29 minutes. So does DOH have the plan to use this kind of testing kit?
Yes. In fact, I just sent a text message to my staff to call up the Chinese ambassador so that I'll be able to personally request in behalf of the Philippine government as many testing kits as they can provide us. And this would be very good, provided that there's going to be the WHO experts through its emergency use lab or list that will validate the effectiveness of such a testing kit. There's very little or limited knowledge we know about the testing kits being used by China, South Korea, and another country, I forget. But it's very important that we are sure about the results that come out, because it's going to be very scary when you have false negatives. Okay, you say a person is negative, yung pala positive, and then you let them go thinking that they're okay. So we have to be very, very cautious about this. So that's one. Number two, certainly the experience in China has served the interest of the global population, the health officials. The data that we have gotten are a bit reassuring, to say the least, that 80 to 82% are mild of the cases, and then about 15%, 13 to 15% moderate to severe, and 5% would be critical, and of that, about 2 to 3% within Hubei and Wuhan City. The case fatality rate is somewhere between 2 and 3%, a little bit higher. But outside of Hubei, the information I have gotten is that the case fatality rate is very low at 0.7%.
I have one more question to Mr. Benzon. And do you have the confidence with the Chinese government's work against the epidemic, so that the Chinese tourists can come back to Philippines soon after the epidemic?
We on health matters, we will always defer to the recommendation of the interagency task force and, of course, the Department of Health.
Okay, Rosalie, and then Tuesday.
Good morning po. Kay DFA Asik Menyes po. Good afternoon pala, sir. Sir, regarding po sa Grand Princess cruise ship, kung nakakuha na ho ba tayo ng assurance from the management na hindi na po pinagtatrabaho yung 529 Filipino crew, unlike po nung nangyari dun sa Diamond Princess cruise ship?
With regard to Grand Princess, ang gusto namin mangyari ay hindi maulit yung nangyari sa Diamond Princess, na tumagal sila on board, and I think there has been a lot of commentary tungkol dun sa pag-handle ng Diamond Princess. So, base sa mga information namin ngayon, tomorrow in the US, Monday, ibababa na yung mga passengers, and there will be a quick disembarkation, tapos lalabas uli yung ship, at yung crew dun muna sila sa ship for quarantine procedures. Pero gusto namin malaman ngayon from the US government if there is an opportunity, or if it is considered safe to have them repatriated sooner. Then we will of course, try to ensure that their health is protected. So kung ang advice ng mga medical authorities ay dapat siguro mag-quarantine muna, then they may be able to do so on the ship. But in a better situation, kasi nung nangyari sa Japan, inantay muna yung 14 days, tapos pinababa yung mga pasahero, and then nag 14 days pa uli yung mga kababayan natin and all the crew. So, as of the information today, mukhang ang US government mas mabilis yung pagbaba, and then hopefully mas mabilis din yung mga decisions with regard to the crew on board.
Sek, nabanggit niyo po na gusto niyo pong malaman kung may opportunity na ma-repatriate na po yung mga kababayang Pinoy. Meron na ba tayong formal communication with regards to Grand Princess Cruise Ship or US government?
This is being discussed today. Kagaya ng sinabi ko, depende rin sa recommendations ng health authorities. So kung ano yung recommendations ng health authorities, and kung we will follow that. But of course, if there are no restrictions, then ang gobyerno natin gusto nating pauwiin kagad yung mga kasamahan natin. Again, subject to the recommendations of our own Department of Health.
Follow-up lang po kay Secretary Duque, kasi kayo po mismo nagsabi na mas delikado kung magstay sila sa ship. Yung pong mga Diamond Princess Cruise Ship nagkaroon ng lapses, sir. So magiging exposed po sila sa virus kasi nga po may mga infected na po doon sa ship. So ano po bilang pangunahin po dito sa IATF, sir?
Well, unang-una kailangan natutunan nila yung mahalagang leksyon doon sa karanasan with the Diamond Princess Cruise, which the Japanese health minister himself admitted they were very sorry about the lapses in the implementation of quarantine protocols. Kasi ang nangyari doon, hinayaan nila yung crew na magsilbi pa rin ng mga pagkain, magsilbi lang kung ano-ano, pinuntahan yung mga passengers in their cabins, and that really exposed them. So, ang nangyari na extend yung quarantine period, first for the passengers, that was done because they were isolated in each of the cabins. Unfortunately, doon sa mga crew, yun yung nagkaroon ng sliding exposure. So, what they did was to quarantine again for another 2 weeks. The crew members, of which a sizable number would be the Filipinos, no? Naandun na ngayon sila sa NCC. Thankfully today, not one of them has been tested for positive. So 2 days na lang, then mag-graduate na po yung 458, no? And hopefully they'll turn out all negative. In fact, we had them tested again just to make sure, no? Na before we set them free, we let them go back to their communities. Talagang wala silang COVID infection. Pero ito naman sa San Francisco, dapat siguraduhin nila na hindi mauulit yung nangyari doon sa unang Diamond Princess Cruise. Ito sa Grand, ang mangyayari dyan, kung tingin ko lang, I'm just speaking my mind out. Kung matapos nila i-quarantine in isolation bawat pasahero, dapat gawin din nila yon pa bawat sa crew members. I-isolate mo din isa-isa.
Pero sir, hindi niyo po ba i-recommend na i-repatriate na lang since pabababain naman na lahat ng pasahero? Wala nang may iwan sa cruise, liban po doon sa mga crew?
Kasi ang quarantine protocol ng bawat bansa, dapat sinusunod natin yan. Nirespeto natin yan. So, kagaya na nangyari sa Princess Diamond Cruise, they were tested. They will not be allowed to be repatriated based on the protocol if they are positive and if they are symptomatic. Thank you.
Sorry sir, last question po on my part. Regarding naman po sa protocol sa pag-i-issue ng information, ano po ba ang basic protocol ng DepEd? Paano natin babalansehin ang transparency at para maiwasang magpanik ang public? At ano po naman dapat ang maging reaksyon at aksyon ng mamamayan regarding po dito sa information on COVID?
Well, ibig mo sabihin DOH, not DepEd, but DOH. Yes. DOH ba yung ibig mo sabihin?
Yes, opo.
DOH, yeah. Rinig ko kasi DepEd. So I thought you were referring to another agency. Tayo, dapat ang pinanggagalingan po ng lahat ng impormasyon mula sa Department of Health. Kasi kami po ang may hawak ng mga detalye ng mga impormasyon. Pero kinakailangan ay ripasuhin muli itong ating reporting protocols at tingnan natin kung paano ma-align yung mga LGU reporting protocols at ma-harmonize natin para hindi nagkakaroon ng tila nagre-report ang LGU ang dating sa mamamayan ibang kaso ito doon sa na-report ng DOH earlier. So we will just harmonize. We will do the review and alignment.
Paano naman po maiwasang magpanik ang public, sir? Kasi nauuna po yung mga information sa social media nang wala ng yung talagang galing sa government, sir.
Yung kasi pong pagkalat ng fake news at mga kung ano-anong mga impormasyon na unverified and unvalidated, wag po sana tayo magpagamit bilang kasangkapan sa pagpapalawig ng mga pekeng mga kaalaman. Siguro doon po sa ating mga kababayan, ako po ay bukod tanging nakikiusap. Wag po kayong maging tagapagkalat ng mga ganitong mga balita. Siguro maganda po tanungin muna ninyo ang sarili ninyo bago pindutin ang mga keyboards ng laptop at saka ng inyong mga iPad, iPhones, no? Naghugas na ba ako ng kamay ko ng 20 seconds? Magdasal na rin po kayo na sana mawala na po ang COVID-19 sa buong mundo. Pero first things first, tanungin nyo ang sarili ninyo. Galing ako sa palikuran, baka nakalimutan ko maghugas ng kamay, kung ano-ano na yung pinipindot ko. Doon pa lang sa inyong tahanan, baka kayo ay makapagkalat na ng mga iba't ibang impeksyon. Hindi lang po usaping COVID-19. Marami pong mikrobyo sa Pilipinas na pwede po magdulot ng mga malubhang karamdaman at komplikasyon na talagang, lalo na ang mga matatanda, ang silang talagang mga vulnerable population. No? So pangalawa, nagbaon na ba ako ng panyo bago ako umalis? Para akin matakpan ang bibig, ang ilong, at itinitigil ko na ba yung pangangalikot sa mga iba't ibang butas ng muka at ulo, tenga, mata, kinukuskus mo ba? Ito yung mahirap po ito, no, na itigil kasi subconsciously we're doing it. So dapat siguro sa umaga, kailangan talaga sabihan na natin sarili natin, na kung saan pumapasok yung daliri ng kamay, okay? Kung saan mga butas, ay pwedeng ito ay maging kasangkapan sa pagkalat ng mikrobyo, hindi po tama ito. So, pakiusap ko, bago kayo magkalat, sagutin niyo muna yung mga tanong na yun. So, yung ako ba ay sapat sa masaganang masustansyang mga pagkain, mayaman sa vitamin C. Napaka maganda po ang vitamin C. Marami na pong lumalabas dyan na talaga nakatutulong sa pagpapalakas ng resistensya. So, wag po natin abusuhin ang ating mga katawan. Maging mabait po tayo sa ating mga sariling mga katawan. Para sa bandang huli po, ay ito ang siyang katulong natin para po hindi tayo magkasakit.
Okay, thank you. Last four. Tuesday, Jen, Mela, 5 pala. Sige.
Secretary Duque, sir. Sir, nabanggit nyo kanina na huwag agad magpapakalat ng mga informasyon kung hindi naman verified. Pero mismong LGU, sir, ang nag-a-announce na kaagad. May coordination ba ito kaagad sa inyo bago sila magsalita na may positive cases doon sa kanilang localities? Like for example, sa Marikina na nag-announce na po, mayroon daw po doon. And then sa QC, mayroon din daw po doon.
gaya po ng sinabi ko kanina, ay magandang pagkakataon ngayon, ripasuhin itong mga reporting protocols at i-harmonize at i-align para pare-pareho kami ng sinasabi at hindi nagdodoble, di umano ang impression parang may ibang kaso. Samantalang pinag-uusapan parehong kaso. So ang ating pong mga contact tracing teams, ang aking pong aatasan na linawin sa mga local chief executives kung kailan sila dapat mag-anunsyo ng mga kaso para nang sa ganon talagang ang ugnayan malinaw at ang komunikasyon bukas.
So ang sinasabi niyo, sir, mag-uutos po kayo ng tao ninyo na makikipag-meeting sa mga mayors?
Tama po kayo.
Apo. Another thing, sir, paano po natin i-reconcile yung panawagan ng Department of Health na iwasan munang pumunta sa mga matataong lugar para makaiwas din dito sa banta ng COVID-19? And then yung promotion naman ng Department of Tourism na hali kayo, bumiyahe kayo para sa ma-promote ang ating domestic tourism. So, medyo baka nalilito na ang public para sa mga panawagan na ito, sir.
Bago po tayo nagkaroon ng localized transmission noong March 5, meron po naging kasunduan ng DILG, DOH, and NDOT na okay lang yung pumunta sa mga mataong mga lugar, bagkus siguraduhin muna natin na yung mga precautionary measures are in place. Kagaya po ng halimbawa sa mga hotel, kinakailangan sapat po ang kanilang mga disinfectants, sapat po ang mga chemicals for disinfection, yung pong thermal gun na tinuturo doon sa noo para alamin kung may lagnat. So, ito po yung mga ilan halimbawa ng precautionary measures. Pero ngayon po, na meron na tayong localized transmission, dapat lalo po tayong mag-iingat. At kasama po sa pag-iingat ay yung ating paulit-ulit na paalala na iwasan muna ang mga marataong lugar. Ngayon, hindi pa kami nakapagpupulong ng Interagency Task Force mula nung nakaraan linggo at mamaya ay akin pong palulutangin ang isyung ito para mapagkasunduan po kung ano ba talaga ang messaging na kinakailangan pampubliko.
Okay, Jen? Secretary Duque, good morning, sir. Sir, you said, sir, good morning, sir. Sir, you said before that we have a global shortage po sa materials and chemicals used for testing COVID-19. Na-address na po ba natin itong problem na to, sir? How many testing kits do we currently have? And is it enough, sir?
Well, the WHO has been very helpful in terms of supplying us with the needed testing materials or testing supplies. And they will, right at the moment, our testing capacity is about 4,500 tests, individual tests. And I understand from Dr. Rabi that they will again deliver about 2,000 testing kits or extraction kits by tomorrow. And the WHO country representative has also committed to us to identify their suppliers because we have the money, but we just need to ascertain that the testing kits are pre-qualified by the WHO to ensure that the test results are accurate, they're credible.
Sir, follow-up lang. Sir, himayin ko lang po, sir. Ano po yung ating capability sa testing? Sino po ba yung dapat mag-undergo nitong mga test na to? Sino din po yung dapat mag-conduct, sir?
Okay. Ang testing is prioritizing those who are symptomatic, those with history of travel and exposure. Ito po yung kailangan natin unang gawin. Marami po tayong naririnig na nagsasabi, bakit ang DOH hindi mag-test na gaya ng ginagawa ng iba? Unang-una, sinabi po natin may global shortage. No? Hindi po ito na-anticipate ng mga suppliers, mga manufacturing companies. So ngayon, kumahog ang mga suppliers na doblehin, triplehin yung kanilang output. Ganun pa man, kaya nga lagi kami nakikipag-unayan kay Dr. Rabi na tulungan kami tukuyin kasi hindi naman sa ngayon problema ang pondo, meron po tayong pondo. In fact, maraming ang tumutulong, ang PCSO, ang PAGCOR, andyan po ang pondo. Ang problema, yung supply. So, yan po ang ibig kong iparating at dahil dito, dapat we have to rationalize our testing. Yun lang mga tingin natin na talagang may sintomas, at yung history of travel, history of exposure, para nang sa ganon, maging we will be prudent in the use of our very limited supplies. Not of money, but it is really the supplies.
Okay, thank you.
Sir, last na.
Okay.
Last na po. Last one question. Sir, Senators Binay and Marcos are saying na medyo mabagal daw po ang DOH sa pag-release po ng information which causes confusion po sa public dahil nauuna nga daw po ang LGU. And also, Senator Lacson also said that you may have underreported the number of COVID-19 cases. Your reaction to this, sir?
Well, you have to complete the statement articulated by Senator Lacson. He said there is a possibility of underreporting, although not intentionally. Okay, that's the very clear statement of Senator Lacson. And again, this is largely because of our limited testing supplies. As soon as we get more, then we will be able to expand the coverage of who will be tested. So that even if, kasi ngayon, tinitingnan na natin, yung nga lang may mga sintomas. Later on, we will do some calibrated approach to expanding who should be prioritized. No? But at the moment, given the limited supply, we have to be very, very prudent in the way we do our tests. So that's what I would like to explain. Thank you.
Okay, thank you. Friendly reminder, MPC, please limit your follow-up question. May kasunod pa tayong briefing. Mela, and then Ms. Yang.
For ASEC Menyes po, sir, only one question. Sir, do we have an update regarding the reported Pinoy tourist on pilgrimage stranded in Bethlehem because of COVID-19?
If you are referring to yung kaso ni former spokesperson Lasierda with I think 100 others, na-address na ho yung situation na yun. There was reports of their being stranded dahil nga sa travel restrictions, and the DFA was able to assist them. So pinalabas sila through the border with Jordan, and as of yesterday, tinuloy nila yung tour nila, this time on the Jordan side, hindi na sila nasa Israel. So the same is true. If there are others similarly affected, all they have to do is really contact the Philippine Embassy in Tel Aviv or even through Manila, and we will make sure that assistance is rendered.
Okay, Ms. Yan?
Secretary Duque, when it comes to the expenses related to the testing and treatment, will these be shouldered solely by the patients, especially for Filipinos? And considering that this is a highly infectious disease and there will be, is the government providing any kind of assistance to those Filipinos who may not have enough resources for treatment?
Okay, let me tell you this. First, the PhilHealth Board of Directors has resolved to create a isolation package in the amount of 14,000 pesos. Okay, while they're in isolation in a facility, PhilHealth will reimburse the facility for the services that have been provided to the Filipinos who are under the universal health care, are now members of PhilHealth. Okay. Number two, hopefully the condition of the isolated patient doesn't deteriorate. However, if it does, inevitably, in some instances, there will be already an automatic kicking off of the mild to moderate pneumonia package at 16,000 pesos per case. Should that further deteriorate into a serious case of pneumonia, that will now be reimbursed in the amount of 32,000 pesos. Remember, the testing is also being subsidized by the government at 6,000 pesos per test. So you can just imagine, this is more than 50,000 cost to the government for every patient that gets isolated, gets treated because of mild to severe pneumonia. So if you add your math, so you have 14,000. If it is a mild case, that's 16,000. That's 30,000. Okay, plus 18,000. That is already 58,000. 48,000, including the tests, the costs of tests. And if it were a severe pneumonia, that's easily way past 50,000.
But it's only limited to those with PhilHealth memberships?
Well, as I've said earlier, under the UHC law, most, if not almost all, are now members of PhilHealth.
Okay, last four. Francis, Sam, Trisha, and then Pia.
Hello po, Sec Duque. Pinapalinaw lang po kung totoo po ba na kasi sa summer months na raw po, kung malilesen raw ba ang cases ng COVID-19 because of the heat, because of the summer, sir.
Sana po, totoo. Ang masasabi lang po natin from the literature, from the journals that we read, that the virus is very difficult to inactivate when the temperature is low and when the humidity is dry. Okay, when there is low humidity and low temperature, it's very difficult to neutralize the virus. I have yet to see. Perhaps Dr. Rabi might want to add to that information. And if that is true, then we should rejoice that summer is just around the corner. It will mean more sweat, more perspiration, but we don't mind. The trade-off is well worth it.
If you want me to comment, there was early belief that this virus will disappear like the SARS virus with increasing ambient temperatures. What we are seeing more recently is not supportive of that. We are seeing continuing transmission in very tropical countries like Singapore, Malaysia. And so the evidence we have at this point of time is not supportive. But having said that, certainly how long the virus survives in warmer countries with high humidity is much less than in colder, low humid circumstances. So this could work in favor of lower levels of transmission, but there are other factors such as overcrowding which could work negatively and contribute to increased transmission. So the actual outcome will depend on each country's situation, and that's why we continue to urge countries to identify cases, follow-up cases, and define as early as possible clusters. And this is particularly important for countries like the Philippines now, where you have localized transmission, defining those clusters early through aggressive, speedy, strengthened case contact tracing, and clearly demarking those clusters will help to have an aggressive localized response to contain the spread. And we still believe that countries like Philippines, and in fact even countries like Korea and Italy, where there are considerably higher numbers of cases, can contain it by following a response as has been demonstrated very successfully by the Chinese government.
Okay, thank you. Sam, then Trisha, and last Pia.
Kay Secretary Duque lang po. Earlier nabanggit po nila, sir, na hindi pa premature pa rin mag-declare ng lockdown for Metro Manila. Ano po yung mga factors na kinoconsider ng Department of Health before declaring a lockdown?
Well, yung sinabi po natin yung sustained community transmission. So marami ng mga clustering of cases sa mga iba't ibang lugar, halimbawa within Metro Manila. So isa po yan sa mga options na pwedeng isagawa ng atin ng gobyerno. Itong tawag po dito yung community quarantine or lockdown.
Tapos sir, tatanong ko lang po, magkano po yung budget po bali na nakalaan for COVID-19 specifically? Yung nabanggit po nila kanina.
Well, meron tayong naaprubahan ni Pangulong Duterte na 2 billion 25 million for the procurement of personal protective equipment. Wala naman po kasing gamot or bakuna. So, yan lang po muna ang malaking pondong paggagamitan. At yung susunod na high cost dito, yung sa testing materials, meron pong 420 million na ibibigay ang PCSO, aprobado na po ito, para po mapondohan ang karagdagan testing supplies and materials. At meron din po ang PAGCOR na ibinalita sa akin ni Chairwoman Domingo, na meron din silang standby fund at 150 million for procurement of testing supplies.
Sir, clarify ko lang, ano po yung anong status na po ng procurement po ng additional equipment? Nasa ano na po ba, initial stages pa lang po?
And actually yung PITC kasi, ang para G2G na, mas madali. Sila na po ang inatasan natin with an agreement with Secretary Mon Lopez na sila na po ang mag-procure. So, akin pong pinapaalala kay Secretary Mon Lopez na kinakailangan ay mas mabilis ang procurement process.
Ay, sir, last na lang po. Meron na po ba kayong ni-recommend na mga items na kailangan ng i-price freeze sa Department of Trade and Industry?
Sa ngayon, wala pa. Although, nung unang pagkakataon pa lang, nag-price, meron suggested retail price na, no, na hindi ka pwede lumampas doon for, say, surgical mask. Parang hanggang 12 pesos yata. So, meron price range, pero kailangan ripasuhin. We will review the pricing structure.
Okay, thank you. Trisha, and then last Pia. Microphone, please.
Secretary, we'd just like to confirm this information. Pasig City Mayor Vico Soto said that there is a patient or Pasig resident who also tested positive for nCoV. Part na po ba to, sir, nung 10 confirmed cases? Or hiwalay pa po?
Hindi ko pa alam dahil titignan ko ba may pagbalik ko sa DOH.
Okay.
Kasi very dynamic yung situation. So, I cannot answer that right now.
Sir, also, hingi lang po kami ng update dun sa rapid testing kits from yung ginawa ng UP, from University of the Philippines, and at the same time, yung iba pang alternatives na tinitignan natin na treatment. Like, for example, di ba we tested samples of the virgin coconut oil to Singapore. Any updates, sir?
Yung sa rapid diagnostic test ng UP Institutes of Health, NIH, no? Yan po ay pinahintulutan na ng FDA Director General si Yusek Eric Domingo na i-endorso sa WHO through the emergency use list para po yan ay ma-vet na siguradong safe and accurate yung RDT. Okay? So, aantayin po natin yan. Pero nagawa na po ng FDA yung kinakailangan niyang gawin para ma-endorse. Ano? Yung pangalawa naman ay ang mga VCO ay nakausap ko po si Ginoong Toby Dairit. Ano? At ang panukala niya kung pwede daw isama na sa treatment protocol para makita kung effective nga ba. At the same time, sinasabi niya na ipapadala pala o napadala na di umano sa Singapore. Kasi doon ay meron na silang nauna sila nagkaroon ng mga local cases, no. So hindi ko lang alam kung ano na naging resulta nung paggamit ng VCO. But we need more evidence. So that's what I can report to you as of now.
Okay, thank you. Last Pia.
Isang patanong lang po sa office kay Secretary Duque. Sir, is the IATF looking to magbigay ng exemption or to give an exemption for sa travel ban sa China para makabalik yung mga stranded OFWs daw?
No, pwede naman sila talaga makabalik basta ba OFWs eh. They've always formed part of the exemptions.
Sa China, sir, China. Mainland China.
Galing sa China ng mga Pilipino, yung sinasabi mo?
Mga papuntang China, sir.
Papuntang China? Hindi muna kasi the situation there still a bit difficult pa rin.
Thank you, sir.
Okay, thank you, Pia. Thank you, Secretary Duque. Last words, please.
Okay. Dr. Rabi?
Dr. Rabi, please.
Thank you. So finally, I'd like to say that WHO has been working with the DOH very closely right from the beginning of this outbreak. Recently, we've increased our support, so we've got staff working with the DOH staff in the contact tracing, strengthening the infection prepared and response, and also strengthening the laboratory capacity to expand detection. What is important is for our actions to be dictated by facts and not fears, and to identify clearly around the cases where are the clusters, what are the margins, and work to contain the transmission within those clusters and stop transmission beyond the clusters. So again, we reiterate that this is not, while acknowledging the proactive leadership of DOH and the government, this is a time for every Filipino to take measures to reinforce the messaging we've done about hand hygiene, cough etiquette, social distancing, especially if you're having respiratory signs and symptoms. This is a time for each of us, if we have respiratory signs and symptoms, if we've had contact with probable or possible cases, to self-isolate and notify the authorities so that appropriate measures can be implemented to contain further spread. So we urge every Filipino to take responsibility to protect themselves, to protect the vulnerable in their families, and to support the healthcare workers in this effort. We need to work as one community together to respond to this situation. And WHO remains committed to support the government of Philippines and the Filipino people in this response effort. Thank you.
Thank you, Dr. Rabi. Secretary Duque.
Well, ako po ay nagpapasalamat sa PCOO sapagkat napaunlakan na naman po ninyo kami sa aming kahilingan na maipag-ibayo ang mga pinakahuling mga balita o impormasyon patungkol po sa namamayagpag na COVID-19 dito po sa Pilipinas. At malinaw po ang atin pong mga messaging sa taong bayan na sundin po ninyo ang mga impormasyon lamang na nanggagaling sa inyong Department of Health at makakasiguro po kayo na itong mga impormasyon na ito ay talaga pong mga kapanipaniwala or credible pieces of information. At wag po tayo magpagamit, magpakasangkapan sa pagpapalawig ng mga walang batayan o basihan na mga impormasyon o kaalaman. Bagkus ito ang ginagawa lamang ay palalain ang agam-agam o ang takot ng ating mga kababayan. Kahit na saan pong anggulo natin tignan, wala pong kabutihan ginagawa ang inyo pong mga fake news na ikinakalat. Kahit na ano pong gawin natin, sayang lang po ang panahon natin. Tanungin nyo na lang muna sarili ninyo, nagugas na ba ako ng aking kamay? 20 seconds, isama nyo na rin ang dasal para itong COVID-19 ay mawala na sa buong mundo. Maraming salamat.
Okay, Yusek Benson.
Gusto ko rin magpasalamat sa pagkakataong ito at napaliwanag rin namin yung mga ginagawa namin sa Department of Tourism. Siguro sasangayin na lang ako sa sinabi ni Secretary Duque, no, na sundin lang natin itong mga precautionary measures, basic hygiene, no, kasi at huwag tayo masyadong maalarma. Sa amin naman, sa Hainay ng Tourism, gagawin namin ang lahat para tuloy-tuloy lang aming tourism activities, kasi ang pinakadulo naman ito gusto natin na tuloy-tuloy ang hanap buhay ng ating mga kababayan, especially at the community level. Maraming salamat.
Asek Menyes.
Maraming salamat. We wish to stress that despite the multiple fronts that the Philippine government is facing, both here and abroad, we believe that the government's whole-of-nation approach is continually being improved upon and has been successful so far. We call for the public's support to contribute positively to this effort to address the serious COVID situation. The Department of Foreign Affairs is also continuously discussing and seeking to improve our handling of the situation abroad. It should be realized that in all instances, it is the foreign government that has primary control over the health protocols and even movement of all people within that country. The DFA will exert even more effort to ensure the safety and welfare of our kababayan abroad. Makakaasa po kayo na tutulong ang DFA sa mga kababayan natin doon. I am so sure that we will overcome the situation that nakabook na nga ako ng travel package ng DOT in the near future. Maraming salamat.
Salamat po sa ating mga bisita. Salamat din kay Asek Queenie, Director Pebbles Duque, back to our main studio sa Radyo Pilipinas and People's Television Network.